Are you turning 65 or helping a loved one navigate Medicare for the first time? You might assume that Medicare kicks in automatically, but the truth is, eligibility and enrollment rules can get confusing very quickly. This video will explain who qualifies for Medicare and outline the Medicare eligibility requirements. So who exactly is eligible for Medicare? To qualify for Medicare, you must meet at least one of the following requirements. You are 65 or older and either a U.S. citizen or a legal permanent resident who has lived in the country for at least 5 consecutive years. Or you are under 65 years old and have a qualifying disability, and you have received Social Security disability insurance benefits for 24 months. You can also qualify at any age if you've been diagnosed with end-stage renal disease or amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. If this is the case, Medicare starts immediately upon eligibility. Without the 24-month waiting period, you or your spouse must also have worked and paid Medicare taxes for at least 10 years to receive premium-free Part A coverage. If you haven't met that requirement, you may still be eligible to enroll, but you might need to pay a monthly premium for Part A, whether you're preparing for retirement or managing care for someone else. This video will give you a clear roadmap. Stick around, and by the end you will know exactly who qualifies for Medicare, how and when to enroll, how to avoid costly lifetime penalties, and how to choose the right coverage for your needs and your budget. Visit quote.com today. Quickly discover exactly how much you could save. Start by entering your zip code, then review available options, see if you qualify for lower rates, and enroll with confidence. Medicare is divided into 4 main parts, and understanding each one is crucial to building a plan that actually works for you. Part A is hospital insurance. It primarily covers inpatient hospital stays, care in a skilled nursing facility, hospice care for terminally ill patients, and some limited home health care services. Most individuals qualify for Medicare Part A without having to pay a monthly premium, as long as they or their spouse have worked and paid Medicare taxes for at least 10 years. Part B is medical insurance. It helps cover medically necessary services such as outpatient care, doctor visits, preventive screenings, laboratory work, durable medical equipment, mental health care, and some home health services. Unlike Part A, Part B requires a monthly premium, which can vary depending on your income. Most people pay a standard amount, but those with higher incomes may pay more, based on their modified adjusted gross income. Ready to compare plans and prices based on your zip code? Visit quote.com today to get started. Simply enter your zip code and use our easy-to-use platform to check your Medicare eligibility, explore and compare local plans side by side, and confidently enroll in the one that best fits your needs. Part C is also known as Medicare Advantage. These are plans offered by private insurance companies, approved by Medicare, that combine coverage from both Part A and Part B. In addition to hospital and medical insurance, Medicare Advantage plans often provide extra benefits, such as routine dental care, vision exams, hearing aids, over-the-counter allowances, transportation to medical appointments, fitness programs or gym memberships, and more. Part D is your standalone prescription drug plan. It is designed to help cover the cost of medications prescribed by your healthcare provider, including both brand name and generic drugs. These plans are offered by private insurance companies that contract with Medicare, and may vary in terms of covered drugs, pharmacy networks, and monthly premiums. But they play an essential role in helping you manage chronic conditions and maintain your health over time. With original Medicare Parts A and B, you can visit any doctor or facility that accepts Medicare nationwide. But it does not cover everything. Many people purchase a Medigap plan to help cover out-of-pocket costs, and a Part D plan for prescriptions. Head over to quote.com to get started and find the plan that fits you best. Enter your zip code to compare local Medicare plans, check eligibility, read reviews, and enroll in the best fit. Medicare Advantage plans, on the other hand, combine everything into one package. They often have lower monthly premiums and offer additional perks, but you may be restricted to a specific network of providers. You are eligible for Medicare if you meet 3 core requirements. If you have been receiving Social Security disability insurance payments due to a qualifying disability for a continuous period of at least 24 months, regardless of your age at the time of eligibility, you may qualify for Medicare coverage before 65 years old. If you have been diagnosed with end-stage renal disease, a serious and long-term medical condition that requires regular and ongoing dialysis treatments, or a kidney transplant in order to survive and manage your health effectively, you are automatically enrolled in Medicare Part A and Part B without needing to apply. If you have been diagnosed with amyotrophic lateral sclerosis, which affects nerve cells in the brain and spinal cord and impacts muscle control, for these qualifying conditions, enrollment happens automatically. There is no age requirement and no waiting period once eligibility is confirmed. Even if you are eligible, Medicare enrollment does not happen automatically for everyone. Head straight to quote.com to slash your insurance premium. Enter your zip code in our free quote tool, answer a few simple questions, and compare top plans in your area, all in minutes, and take control of your coverage. Your initial enrollment period, or IEP, starts 3 months before the month of your 65th birthday, includes your birth month, and extends for 3 months after. That gives you a 7-month window. Missing that window can be a costly mistake. Late enrollment in Part B or Part D can trigger permanent penalties that increase your monthly premium for life. The longer you wait, the more you can pay. That's why it is so important to understand when and how to sign up, especially if you are not yet collecting Social Security benefits, because in that case, you will need to actively enroll. Each option has advantages and drawbacks. The right choice depends on your personal healthcare needs, financial situation, and whether you value flexibility or simplicity. If your income is limited, you may qualify for both Medicare and Medicaid. This is known as dual eligibility. People who qualify for both programs can often enroll in a special needs plan. These plans are designed to coordinate care more effectively and reduce out-of-pocket costs. They can be a lifeline for people with chronic conditions or financial hardship. Now let's break down the typical costs so you know what to expect. Part A is free for most people if you or your spouse worked and paid Medicare taxes for at least 10 years. Part B carries a standard monthly premium of about $174, though it can be higher if your income is above certain thresholds. Part D costs vary by provider and income. Medicare Advantage plans may have low or even $0 premiums, but be sure to review coverage details, copays, and provider networks carefully. Keep in mind that healthcare costs can differ based on your location. That's why comparing local plans in your zip code is essential for getting the most value. When you are ready to enroll, be sure to have the following documents on hand: proof of age, such as a government-issued ID, proof of U.S. citizenship or permanent residency, a work history summary showing you or your spouse paid Medicare taxes, disability documentation if you are qualifying under age 65. Head over to quote.com to start lowering your insurance costs. Just enter your zip code, answer a few quick questions, and explore personalized plans tailored to your needs and budget. If you found this video helpful, give us a like and subscribe to our channel for more straightforward Medicare tips and advice on how to find the best insurance coverage for all your needs. Thanks for watching.